Welcome, everybody, to what will hopefully be the first in many webinars. Army Nurse Corps Association has taken on an additional mission or a project, and that is around transitions. How do we help our service members transition from the military to civilian life, regardless of status, whether you're reserve, National Guard, active duty, if you're a captain, major, lieutenant colonel, or a general? It doesn't matter the rank. We want to be there for our fellow Nurse Corps officers who've served America's sons or daughters. Today, we're going to kick off our transition series with Major General retired Jimmie Keenan. She has a long list of accolades and instructed I should keep it rather short. But let me just tell you, she was the chief of the Army Nurse Corps, of course. She's also a commander of the United States Army Southern Regional Command, United States Army Public Health Command, Evans Army Community Hospital, and other very important leadership positions. I'll just let you know that she is a fellow expert field medical badge holder, parachutist badge, air assault badge, an Army staff identification badge, and she has many awards. I had the pleasure of serving with General Keenan in several assignments. So without further ado, I'd like to hand it over to Major General retired Jimmie Keenan. General Keenan?
Thank you, Ed, so much. It's a pleasure to be with everybody tonight. I see a lot of familiar names on the attendee list. We were having a conversation as we were preparing for the 125th, and I have to plug that, our 125th Army Nurse Corps birthday celebration, which is going to be the 6th of February. But we were having different conversations around that. And one of the conversations we had was around transition. And as Ed said, everybody transitions. We all transition at some point. And so I want to share a little bit of what I've learned, some things I learned the hard way. I don't want you to have to do that, but just some ideas and thoughts that I found helpful for myself and for others as I helped them transition. It'll be 10 years for me in December. And so I want to share those with you all tonight. And we're going to have a little dialogue. So if you do have questions, please put them in the Q&A and I'll be happy to answer them. So I'm going to have Nikki pull up my slides. So again, a lot of people think transition is, probably the most difficult part is figuring out what we have to wear. But there's a lot more to it than that. And I'm going to talk about some of the common things that we need to focus on when we transition, and some of the things we probably shouldn't do as we're transitioning. Next slide, please. All right, so this will be the agenda. This picture, I included this picture because this picture was from the 4th of November of 2015. This was on my retirement day with my family. My husband, John, who is retired engineer colonel, our daughter, Katie, who was a sophomore at Cole High School and at Fort Sam, and then our son, Will, who was a senior in high school at Cole High School. And so that was an important day for us, is that we knew this was my last official day really in uniform. And so what I want to talk about is understanding the civilian job market. We're going to talk about resumes, about LinkedIn, and then some of the social media do's and don'ts for professional branding. Next slide. All right. So as Ed said, I'm a nurse. I always said, many of you remember this, I always said I was a soldier, then a nurse. I've also taken on some new roles since I retired. I do a lot of volunteering now. You'll see a picture down there, a small one with a little dog in it. That was in the Dominican Republic, where I went with One World Surgery. And then you see a cute little guy That picture was from like around the 13th of October of 2024. That's my grandson, George. If you stay the whole presentation, you'll get to see a more recent picture of George. George is getting ready to turn 1 on the 5th of October. And so we take on many different roles in our career, but I have to say, probably my most favorite one now is being a Gigi. That's my grandma name. Next slide. So, when we think about our military roles, many times when we sit down to put together a resume, we have to realize that some of the terminology is not the same that's found in civilian healthcare. But I will tell you, a lot of the things that we do in the military have a direct correlation to civilian healthcare. And so you want to be able to understand what those differences are and also be able to translate your roles and responsibilities that you've had in the military to that civilian language. The other thing is, as you're doing that, it's really bridging that gap of knowledge. I will never forget as I was transitioning out and I went to several interviews, and one interview I went to, they said, well, because you were in the military, we know many soldiers and veterans have PTSD. And so there was an assumption that because I've been in the military that I had PTSD. And so we have to understand that in some cases, we're going to be going to work for organizations that really don't have much experience working with the military. And so we have to be able to bridge that gap. Next slide. Yeah. As I said, many of our roles are transferable, and those skills are. So really being able to identify how those skills crosswalk when we think about leadership positions, commanding a hospital, that's like being the CEO of the hospital. When you think about being the deputy commanding or the deputy commander for nursing, or you think about being a section supervisor or a charge nurse, taking those roles and talking about how those correlate with the role that you might be interested in. And then I have to tell you, employers really are anxious to hire military, and a lot of it is because we understand leadership, we understand how to effectively work as a team. And then I think probably the most important thing is they understand that we have a value set, and they understand that we understand integrity, and we also understand accountability, and being able to account for ourselves and being able to show up, to understand when we're given a mission or a task. That is critical to be able to articulate that in your experiences that you've had in the military. Next slide, please. Now, a lot of people say, how do I go find a job, right? Well, I will tell you, I researched different organizations to look at, did they have similar value sets that were important to me? I also, got approached by some people, but sometimes you're not going to get approached. So you have to go out and, we'll talk a little bit more in a minute about LinkedIn, but it's important if you are applying for a job to learn as much as you can about that organization. And what's great now is this thing that Al Gore invented, which is the internet. And when you think about now the power that we have with ChatGPT, the AI, we can actually get a lot of information on an organization and really understand what the mission is, what their goals are. All of those things are actually out there, and it's just a Google search away. I think for me, that was one of the things that helped me as I transitioned, is really taking the time to research the different employers that I was interviewing with, and then making sure that I aligned that resume that I was sending to that employer so that I used words that were the same words they were using in the job announcement or the job description. Mm-hmm. So really ensuring that you customize your resume to match the job expectations, or to highlight those skills that they're identifying is critical for that particular role. And let's see, what guidance do you have for nurses getting back to bedside after a break in employment? For example, addressing employment break during an interview. Okay, that's a good question. So let's say you took a break. Did you volunteer? Did you do other roles? And you can discuss that. Or perhaps you were in a different role in the Army that didn't allow you to be at the bedside. I will tell you that we do have many nurses that go back to the bedside that may have been in a leadership or a teaching position. And so what you want to make sure you're able to do is talk to them about why you had that break, but what you've done to maintain your skill set. 39 years ago, I got my nursing license. And I tell people every day, that is one thing I make sure that I keep up, is all my continuing education and those skill sets that I need to maintain my license. And I think being able to go to that employer and say, it's very important for me to be able to get back to the bedside. It brought me joy. I have leadership experience that I can help guide and mentor young nurses and staff, and they will see that as a value. So that would be the way that I would address it. I hope that answered your question. Next slide. So let's talk about the resume. I get people sending their resumes, and it's really important that we try to reduce the amount of jargon that we have in a resume. They don't understand those terms. The other thing that's really important is understanding that your resume, when you apply for a job now, everything's pretty much electronic now. And so when you go in and you put attach that resume, they're actually running it through an AI program, and they're looking for keywords. They're not going to recognize, commander, or you name the word that we might be using. Or if, let's say, we try to use, I'm a 66 golf or 66 hotel. They're not going to recognize that, but they will recognize med-surg, OBGYN, or, if I'm an ICU nurse or an emergency room nurse. Those are the things that we have to be aware of, and we have to transition our language. So it's good to have a second set of eyes look at that resume for you to help clear up any of that terminology that might be in there. And also understanding that if your resume is in military jargon, what's going to happen is you'll go, wait a minute, I know I was qualified for that job. Why didn't they call me? Well, remember, the first person looking at that resume is not a human being, it's AI. And so they're looking for those key words. So going back to tailoring your resume where it includes the language that's mentioned. And again, if you got that skill set, you want to include that language. You don't want to overinflate your resume. So I hope that helps and really explains why it's important to relate it back to a civilian occupation. Next slide. So things to highlight: clinical expertise, anything that you have specialized knowledge or hands-on experiences. Let's say if I'm transitioning after my first initial assignment in the Army, is really talking about my, any patient care or specialized training that I have, any leadership roles, the number of people that you led, if you had any responsibility for a budget, making sure that you're able to talk about that, how you collaborated as far as teamwork, and then being able to talk about how you improve patient outcomes. Because once they review your resume and they schedule you for an interview, they're going to give you scenario-based questions. Can you give me a time that you had to help one of your staff through a difficult situation? And so being able to have in your mind a vignette of when that happened, or what you did as far as whether it was related to patient safety or quality, really being able to measure that and give some feedback on that. Next slide. So with your resume, you want to use clear headings. And I'll say this several times: 2 pages. You've got to get it down to 2 pages. Remember, a resume is got to be brief and tell your story. We're not talking about a CV, which, if I've published a lot of articles or done a lot of research, that's different when somebody asks for a CV. The resume, 2 pages. You really talk about what you've done in the last 10 years. If you had unique experiences that are past 10 years, you can summarize those together. You want to use bullet points. And again, you want to talk about your achievements. The best person to write your resume is you, because you know you. One of the things I found helpful and some advice I got was to take my old OERs and actually look in your OER, because there's bullet points in your OER that talked about what you did and gave some of those specific metrics, like that, you managed this number of personnel, you had a budget of whatever the budget was, and these are the outcomes you achieved. That is a good place to start, and then you can work with that. So really highlight those. When we talk about education, it's, around our, where did we get our undergraduate? If we got a graduate degree, they don't really need to see that. And if you saw my resume, which is on LinkedIn, you would see I don't list every school I attended in the Army. The only one I list is the one that I got a degree from, and that was the War College, the Army War College. And so you want to be able to address those that are relevant. Now, that might include if you attended a course that produced, a certification, whether it's, with the ICU or OB, or you're a nurse practitioner or a CRNA. You want to expand on those and talk about that. And again, remember is that they're going to run this. The recruiter will look at it, but they're going to run it through the applicant tracking system, which scans it and really uses AI to to identify, do you meet that first test? Next slide. So let's talk about LinkedIn. When you think about LinkedIn, you're gonna take your resume, and that's gonna help you write your LinkedIn profile. You want to have a professional headline. It needs to be clear, and it needs to define you as a professional. You want to have a compelling summary, and so you can write that summary from your resume, but it needs to be very succinct. You don't want to add a lot of fluffy words in there. And then you're going to actually put your experiences into LinkedIn. And LinkedIn actually allows you to be able to attach, like I said, your resume. LinkedIn you can actually go into LinkedIn and click under jobs, and you can tell them what kind of jobs you're looking for, and they'll actually send you jobs that are job announcements, which is pretty handy. And with that, you can actually apply for those jobs online, and it'll either take you to a link, or it'll take you to a general link on LinkedIn, and it will allow you to attach your resume or to pull the resume that you've got loaded in LinkedIn. So it's very helpful. It's very quick. But again, remember, you want to have a resume that's tailored to that job. Some jobs, they're pretty similar. You can use a similar resume. But if it's a specific skill set that is in that job, maybe it might be something that's not related to nursing. We have a lot of nurse corps officers and others that, they decide when they're transitioning, I want to do something outside of nursing, and that's perfectly fine. So you need to tailor your resume differently for that. Next slide, please. So under accomplishments, you want to highlight any key achievements, certificates, anything that established certifications that you have. One of the certifications I have is that I'm a fellow in American College of Healthcare Executives, and I'm certified as a healthcare executive. That's important to say because people recognize that. It's important to list, are there any groups that you belong to? Because in many roles, they're looking for those that demonstrate that, because they understand, like with the American College of Healthcare Executives, or if you're certified as a nurse administrator, if you're certified in critical care, you name those things, they will key in on those words. Those are things that they're looking for. You also have an opportunity here too to ask. We always ask people for recommendations. Is to actually get someone to do an endorsement for you. You can send them in LinkedIn. You can send them a message and say, "Would you be willing to endorse me for these skills?" That strengthens your profile. Next slide. Now, join different groups. So you'll see different professional groups. You can follow them. So I follow ACHE. I follow the American Academy of Nursing. I follow the ANA. I have different groups that I follow. Also, you can follow those organizations that you might be interested in applying to. So let's say you want to apply to the Mayo Clinic, or you want to apply to the Veterans Administration. Follow those groups. They have groups out there. Follow those, because you'll see where jobs will actually pop up for those different organizations. Also connect. You can, and you'll see some people will put this open for work. Or you can actually check in your LinkedIn, there's a way to check just where recruiters see that you're open for work. You don't have to tell everybody, or you might not want to tell everybody, hey, I'm looking for a new job, especially if you have a job that you're in and your boss, you don't want them to see that. But you can actually check it where only the recruiters will see that you're looking for a job. Also, if you get approached by a recruiter or a headhunter, go ahead and talk to them. Don't blow them off, because, one of the things I was taught when I went through the transition course is, even though you might not eventually go to work with that organization, every chance you get to interview or learn more about an organization, that's good practice. And so I will tell you, I was approached by a headhunter when I was as I was transitioning off active duty, and I almost didn't take the call from them. I was interviewing with other organizations, but I did take the call from that headhunter, and I want you to know that's the organization I actually went to work for. I would have never had that opportunity had I not done that. So you got to stay curious and be open to different jobs and different insights. Next slide. Okay, this is probably one of my favorite things now. Oh, let me see. You got Christine's got a question. Let me go there first. You ever interview with an organization already knowing that you would not accept a job but use the interview as practice? Most of the time I stayed curious, Christine, because it was an organization that I was interested in, but I wanted to learn more about it. And I will tell you, as you go through the process of those interviews, because it's not just one interview in most cases, it's several rounds of interviews, you get that opportunity to peek under the hood. And those of you that worked with me in the Army, one of my favorite things that I used to tell our young nurses was test drive. You'd never buy a car without test driving. Go try that area. Go shadow in that area before you join the organization. That's why learning as much as you can about it is important, because it might not, once you get in there, when you're interviewing, they're asking you a lot of questions, sort of like you're dating, right? Speed dating. And it gets people are trying to be on their best behavior. But you want to be able to think about, is this an organization that I see myself working in 6 months, 6 years, 9 years, 10 years? I was fortunate. I ended up working in my last organization. I was there almost 9 years. But I spent a lot of time and I asked a lot of questions, and they asked me a lot of questions, because you want to make sure it's the right fit. And not every time is it going to be the right fit. But I would say you might go in there thinking you aren't planning to take a job there, and you meet the people and you're like, wow, I can relate to the people. I can relate to the mission. This feels like the right spot. So I'd say stay curious. And then Nancy asked, how do you decide what salary to ask for? I transitioned before internet, but there was virtually no salary information available. Well, I will tell you, I could probably do a whole hour on negotiation of your salary. I was fortunate that I had some mentors, and they told me when I reached that point, they said, when they ask you what you want for a salary, and this is important, you have to write this one down, is first, do not think your salary is just making up the difference of what you got when you were on active duty. We make a lot of mistakes around that. And they'll even ask you, the recruiters, the personnel folks will say, hey, what was your salary? And honestly would say, well, respectfully, that doesn't really matter. You can actually go online and see what the salary is for in 03 and 04 and 05 and 06 and 07. Everybody, it's very transparent and people can count and know how many years people were in, right? And so I always said it's not relevant. What I made in the military is not relevant. That's separate. This is a whole different chapter. This is a new career. And so how you want to address it is, so what would you think the range would be for someone with my education and experience? Put that back on the on the recruiter or the hiring manager to give you a range. Now, in your mind, you're going to have a range. And yes, now we got the internet. You can go online. You can Google what a chief nurse or in a for-profit and not-for-profit, what they make. However, I would not go in and give a number. I would go in and say, what range would you think someone with my education and experience, what do you believe the range would be? And I will tell you, they'll usually come back in with that range of where you're thinking. And then there's other pieces of it, because it's just not the salary. You know, they have these things, when we think about our OER, when we get an award, we're very proud of that. And I'm very proud of all the awards I got in the Army that really were a testament of the people that I worked with. However, when you're in the civilian sector, there are things called sign-on bonuses. In some cases, in some for-profit organizations, there's equity, which is stock. There's all those things that you have to, depending on what type of organization it is, that you might want to know if you should ask about that. And as I said, if somebody is at that point or they have more questions, I'm happy to talk more about that and how you go about that. And I can tell you that as I brought people into my last job, I would tell them and coach them on what to ask or what to say when the recruiter asks those questions. Because you should not take into account what your retirement pay is, or that's a totally different subject. That should not be included in your thought process. Now you're working for this salary, for this range, and that's what you should be focused on. Not making up the difference of your salary now that you're retired. Now, I will tell you, as far as healthcare benefits, we are very fortunate with TRICARE. I know a lot of us, we all like to complain and say different things, but I will tell you, a lot of when you see what the costs are in the civilian sector and the copays and different things, we're very fortunate to have the healthcare plans that we have. So there can be some negotiation there because that's something you're not going to take. So is there something else that you can negotiate? So hopefully, Nancy, I hope that answers your question. All right. So let's talk about posting. You will get, and I mean, I see posts all day long. And so what you want to share is relevant content. You don't want to post just to post, right? Or that I got up and I ate yogurt for breakfast or whatever. We're on LinkedIn. LinkedIn is supposed to be professional. Now, what is actually important is when you comment on somebody else's post. You don't have to actually post, and I see people post a dissertation. You don't have to do that. It's the impressions that people will see. And in my engagement in learning more about LinkedIn, it's not just hitting like or support for a comment or an article you read. And then let's say somebody posts, I just got a new job, I got promoted. I can hit like, and then if I want to hit a comment, they'll give you suggestions for comments like congrats or congratulations. You want to actually say something like, congratulations, Ed, on your new job. They're very fortunate to have you. Keep it simple, but say something. Don't use just the standard blurb that's in there, because it will show up as an impression. Those impressions are what recruiters see. So make sure that your interactions are meaningful. Next slide. Okay. We see all the time people put a lot of personal stuff out there. I will tell you that recruiters, people in those organizations are looking at they're looking at LinkedIn, they're looking at Facebook, they're looking at X, they're looking at Instagram, they're looking at how you post. And so making sure, especially I'd say on LinkedIn, making sure that you limit your personal, who sees your personal content on Facebook, Instagram, those kind of things. You don't need to open it up for the whole world to see. And then one of my favorites is controversial posts. I know we are in a VUCA environment now. It is volatile. It is not professional. And the best thing is left to say is not to say it. And I see people all the time posting and or putting words or images that when they go to try and get a job, there's somebody looking at all of that content. And so if you, I was asked, so what if you're not, you don't care? I don't care. I'm just, when I retire, I'm just going to retire. I'm just going to get out and I'm not going to go to work. Well, you might decide that, but then you might decide later you might want to do something else. And so my best advice to you is just steer clear of it. My mother always told me if I couldn't say something nice about somebody, then not say anything at all. And so, or if you have a disagreement with somebody, have it over the phone. I know that we don't talk on the phone much anymore, but I would not put it out there in social media. Also, that professional profile presentation. So think about your picture on LinkedIn. You want a nice headshot of yourself. Take the time to do that. My first headshot, my husband, lined me up in front of a bookcase, and I was dressed, I had on my running clothes from the waist down, and then I had a nice suit coat on and a shirt, and he took a nice picture, and that's what I used. I later got a real headshot, but make sure that any pictures you post, anything you're doing, that it really reflects professional standards. Next slide. Again, don't overshare. I know people get emotional. They'll read different posts and they'll get emotional and they'll respond to them. Please try to restrain yourself. Use professional language, inappropriate language. Remember, once you put it out there, it's out there. It doesn't disappear. Because this is your credibility. When you think about who's got the most credibility, who is ranked number one, always number one for trust, it's nurses. So think about that as you're posting. Think about that is you want to maintain your credibility and that your personal brand, your integrity. Also, review your profile. I remember I was bad. I went to work for WellMed, and which is part of Optum United Health Group, in February of 2016. And I would post occasionally, and I'd update a couple of things. But I have to be honest, until last October when I transitioned, I hadn't really gone back and looked at my LinkedIn. And I was like, wow, I need to update this. So this is kind of like when you think about fitness, and I still work out, but when you think about your physical fitness, your mental fitness, think about this reviewing your profile, things that you need to add, because you don't know when you might want to join a not-for-profit board, or somebody might contact you about another opportunity, but you didn't get considered because when the recruiters will put search engines in, and they'll message you if they see something that's you have career or experiences that they're looking for. So make sure you go in and you update your picture, because I can tell you the picture I took in January of 2016. I've changed a lot. My hair's longer, and I got some additional wrinkles. So make sure that picture is up to date. Next slide. So this is a quote I love. Life is like a camera. Focus on what's important, capture the good times, and if things don't work out, just take another shot. Sometimes we don't land in the right place the first time. And they'll tell you in the transition courses, most of the time, you're going to have several different other positions, and that's okay. But that's what's good, is that we can take another shot. Next slide. So again, focus on what's important. One of the key things I always tell everybody, decide what you don't want to do first. Decide if there's a job, you're like, I definitely don't want to do that when I retire. Decide what you don't want to do first, and then you can be thinking about what does sound like fun. You have time. You don't have to rush into anything. Also, network. Network is so important. Network with people that are doing those jobs, and you can go on LinkedIn and you can see other nurse corps officers, medical service corps, other people that have transitioned from the military, people you've met in professional organizations. Network with them. Get them to advocate for you, and stay curious, because, again, the place that you might not have thought you would consider working, that might be just the right fit for you. Now, I've included my information below for y'all. So if you do have any questions, and then this picture is of my son, the guy that had the long hair and the chops in the first picture you saw. He is now a captain in the Signal Corps. He's stationed in Vilseck, Germany. And then that's our grandson, George. So he did join the family business. He said he never would, but he did. And, they are living their best lives in Germany now. Don't know if he'll stay in, how long he'll stay in. But I think the important thing is value your service. What you've done, many people, less than 1% of Americans have raised their right hand to serve their country. You are taking care of America's sons and daughters, or have taken care of America's sons and daughters. Some continue to do it because of the jobs that they're in. They've gone back into civil service, or Ed works with the VA every day. He's part of our VA system. So find something that brings you joy. Find something that gets you excited to get up in the morning. Because this time you get to choose where you go. You're not going to have an assignments officer that's telling you or selling you, hey, Fort Polk's a great place to go. Or, hey, we need you to go to this great location in Oklahoma, or all these other places. So again, take the time to take a deep breath. Take the time to take care of you. A lot of times people aren't aware. There's hiring your heroes. There's a internship programs you can apply for. If you can work it out with your supervisor in that last 6 months to go and test drive a civilian organization. We hired a lot of people at WellMed and United Health Group through the program, and they continue to do that today. It's a great program. Other organizations have that program as well, and it allows you to see what it's going to be like on the other side. All right, I got 6:51, and so let's see. I've got a question. So Teresa said, "How's it?" I think it's important to be on LinkedIn. Honestly, that is a professional platform. I've talked to recruiters at Korn Ferry, which is a big recruiting firm, and other headhunter organizations, and they use LinkedIn. So I think it's important to be active. And then Barbara said, "I'm off social media, no Facebook, no Instagram." No, that's okay. It's actually okay not to be on any of those. The most spicy chat I get is the one on my family group chat. Which my husband elected to get out of because he said we were driving him crazy all the time. But it's okay not to be on social media. But if you're in the workforce, I would recommend LinkedIn. And then Christine says, "I can retire in 2029. When you transition out of the military, did you know where you wanted to live already?" No, I didn't. Now, I did have a senior in high school. He was getting ready to graduate, and I had a sophomore in high school. But they were like of the mindset, hey, if we have to move, we have to move. They were used to moving, we moved, my son had moved 13 times, so it wasn't a big deal to him. But I think what you have to decide, there's several things that'll play into this. It depends on if you got your partner, your spouse, your friends, your family. Many of us, when I was transitioning out, my mother was still alive. Looking at, are there other responsibilities that we have? So you have to take all of that into account. And what was important to me is that picture I showed you first is, as I transitioned out of the military, I had my husband, my daughter, and my son, and it was important to me, my family, to do the right thing for them, because I felt like they had given a lot the last almost 30 years that I've been in the Army, and when we all became a family, we think about missed holidays, birthdays, all these different things, is really getting their feedback on, okay, what do you want to do? And so really think about overall, when you choose that location, are you going to continue? Do you want to continue to work? Or do you want to go back home? What does that look like? And so that has to be a personal choice. But if you got people in the house with you, you got to include them in the conversation, because you want to be able to continue to move forward together. Yeah, I can attest, but nothing seemed like home. I'm originally from Southwest Arkansas, a town of 1,500 people, and I didn't see myself going back there because after college, it'd been so long. I knew I wouldn't go there, and also I had a husband that he wasn't from Arkansas. He was from upstate New York originally. He didn't want to go back there, so we decided as a family what worked best for us. So that's what you actually can decide what works best for you. What
General
other
Keenan, General Keenan, those are great comments. I was thinking about this. For me, it was looking at the jobs available, aligning with the mission and vision of the organization, and then also looking at market research. Was I going to stay in San Antonio where there's 127 retired generals and a plethora of retired colonels, where I would be another small fish in a very large pond, or would I take an opportunity elsewhere? And then as I was looking for opportunities, all of a sudden a job came up with the VA in Ann Arbor, Michigan, where I met my husband 26 years ago. And we have family in the area. We love to change the seasons, and it was pure serendipity that we were able to get everything done we wanted to get done. But you have to remain open to possibility, and you have to just be able to sell yourself because you are valuable. Your skills are valuable. So I just offer those words of wisdom. And by the way, for VA, there are very strict guidelines around Facebook, LinkedIn, and other forums where you need to be careful because you're still a representative of the government.
Yeah, no, you're exactly right, Ed. And I will tell you, when I was saying what I didn't want to do, I said I didn't want to be in the federal government. And so, I couldn't even spell Medicare Advantage 10 years ago. I couldn't health plans, all the benefit, all that. I had to learn all that. It was kind of scary, but you know what? It's never too late to learn something new. And so I challenge you, get outside your comfort zone. And like Ed said, yeah, I'm here in San Antonio. It ended up that's where the job was, but it wasn't with the military and it wasn't with the VA. It was very different. It was a for-profit company, but the best part of the mission for me is that we took care of seniors. And I thought, who better, now to take care of the greatest generation, and it really to get a good understanding of value-based care. So keep your options open.
I see Barb Sawyer just made a comment, and I think she's right. We do need to have arrange for a guest speaker for Reserve and National Guard and have them speak about their transition and what their challenges were and opportunities. So that's a great suggestion, Barb. Thank you.
Yeah, I agree too. There's when you think about there's so many topics. Like I said, we could be on here all night, but I know some of y'all, it's like your bedtime almost. I know it's almost my bedtime. But again, please give us any suggestions about what you want to hear more. If you want to hear more about negotiating a salary, or you want to spend more time, actually looking at resumes or anything like that, we're here to help. And that's what I tell people is we are here to help each other. That's the most important thing. Is it doesn't matter what your rank is. We all have to transition at some point. I'll never forget people going, "Why'd you leave the Army?" And I said, "Well, everybody has an expiration date, and that's a good thing because that's what keeps our military fresh. Is that rotation? We can't stay forever, and you'll see some people stay in civilian positions sometimes past their prime, and so." To me, it's a great thing, but we're here to help you. It can be scary. I was a little scared, I can be honest with you, but you know what? I reached out to folks. You can't be afraid to say, "I'm not sure about this," or "What do you think about this?" I still do that today when I'm trying to make a decision about if whether I'm sitting on a board or anything I'm doing. I've got people that I reach out to and ask them those questions and bounce those ideas off of them.
In General Keenan, what I would say is being a member of the Army Nurse Corps Association, we have a whole pool of professionals with so many varieties of interests. You want to learn how to be an SES and VHA? Call Ed Yako. You want to talk about value-based care? Talk to General Retired Jimmie Keenan. If you want to know about, we just have a pool of people waiting to help others transition successfully and with such a wonderful knowledge base. And that's why Army Nurse Corps Association's here, is this level of support you mentioned.
All right. Well, if we have no other questions, or if somebody has a question later, you can send me a text, you can email me, visit my LinkedIn. You can kind of see how I have it structured. If you have questions, you want me to look at yours, or look at your resume, I'm happy to do that. Again, we're here to help each other, because, as Ed said, you are such a value for what you've done, for your service, your sacrifice, your skill sets. They're looking for leaders out there. And it is so volatile right now in the healthcare sector that they need people that know how to show up, that know how to take care of people, and can handle difficult situations. It's not going to get easier anytime soon. But each and every one of you could step in any role out there and knock it out of the park. So thank you all for attending.